Welcome to the weekly. My name's J.O. I'm the author of Maximize Your Medicare. This, God dang it, ridiculous. First up, we're going to have the individual health insurance deadline coming up on December 15th, December 1/5. After midnight, I literally cannot do anything to help you. I literally cannot. The only way around this the only way around this is if you have health insurance and then you have lost it due to something like unemployment. Or, for example, if you have become unmarried and as a result lost health insurance. Something like that. You would need a special enrollment period. Now, there are special enrollment periods. They are in the buyer's favor. Nevertheless, for the rest of us, myself included, midnight, December 15th, there's no other way around it. If you need my assistance on the healthcare.gov website, that's not going to be a problem, okay? Because what ends up happening is you need to have professional permission, and you can presume correctly that I have it. I kind of think we need to name this next part, this segment, with kind of some like cool, catchy name. So if you have suggestions, be sure to, leave them in the comments. And also, by the way, don't forget to like and subscribe to the channel. And also there's a bell, and that's notification. So when a new video comes out, you get told, Anyway, let's go back to this segment idea thing. Let's just call it now sand the floor. And for those of you who don't know what I'm referring to this video that shows up on the screen, right? Which is, what financial fluency is all about. And I called it wax on, wax off. Yeah, we could have called that, but let's just call it sand the floor. Which is, the fact of the matter is, and persons who subscribe to the newsletter have heard me talk and read the book. You hear a common message, which is health insurance is not healthcare. And that's because health insurance is a financial contract. It is a derivative financial contract, much like a put or call from the options market, CBOE, okay, which is Chicago Board of Options Exchange. Anyway, the point here is that it is a financial contract with costs and payouts which are contingent upon certain situations, like you need medical attention. Okay, so contingent upon the need for medical attention, then and only then do you start getting the payout of that financial contract, which is health insurance. Health care, again, an entirely different thing, which is you go to the doctor because you've broken your leg. You require the physician's attention to reset your leg. That is health care. The problem is that people mix these two up. And the problems begin, and I know I'm repeating this for those people who are, frequent listeners, subscribers, readers. But for newcomers, this is the fundamental concept here. The fundamental reason that I wrote Maximize Your Medicare, because right from the jump, people have this mixed up. You're asking the doctor for derivative financial counsel is like you asking your auto mechanic whether or not Tesla stock is a buy. They have auto in common. I get it. Nobody, however, would mistake your mechanic to be a Tesla stock analyst. No one. Nevertheless, because people are so intimidated by health insurance, other financial contracts, the reality is they'll ask whoever they think knows something. So they go to their doctor. Now, again, for the nth time, I'm not a doctor hater. My beloved late father, medical doctor. So unless I didn't like food, let's not start down that path. It is not the fact that the doctor is a doctor that I'm saying. I'm just saying that the doctor is not the area of expertise. But on and on it goes. And people, a professional person, well-educated person says, Jay, why do you keep going on and on about this in such an aggravated way? And she was being critical, and I appreciated that. And I just listened. I said, yeah, I get it. I understand what you're saying, and maybe I shouldn't be this, annoyed and aggravated about it. But the reason is that the reality is, if anything, I'm underestimating the number of times that you're hit with this. And here's yet another example right here, which is here on Twitter. This person, Stephanie Krenrich, tweets, I do health coverage policy for a living, and picking my health insurance for next year was incredibly, embarrassingly hard. Yeah, of course. You're not a derivative expert. You don't understand what the Black-Scholes formula is. Now, you've got your own source of expertise, right? Your own source of expertise. And let's just take a look at her Twitter profile. Director of Federal Relations of this at ACSCAN. Now, I looked up what that organization is. That's part of the American Cancer Society. So consistent with what I always say, right? The other guy's not dumb. That's one of the things that I like to say is you click on that society, you don't attain that role by just being, any old person. I just don't believe that, right? In other words, in health policy, right, you could this person, I'm going to presume, give the benefit of the doubt. I'm going to presume that this person is an acknowledged expert. Otherwise, guess what? A huge party such as American Cancer Society doesn't hire her, right? We have 320 million people, something like that, 300 odd million people in the United States, right? We would have been able to find another person, right, if Miss Krenrich was not qualified. In other words, the only possible conclusion is she's qualified in that area of expertise. And the thing here is, as a result, what's your takeaway? The problem here is even a highly qualified person has presumed that because of the expertise in health policy, presumes that they should be able to find the selection of health insurance contract to be easy. Well, no, of course it's not. Of course it's not to this person, because this person doesn't have the derivative background expertise. And here then is the problem. And as a result, again, back to the name of the segment, which is sand the floor. And by sand the floor, what I mean is you must clearly define what you are actually looking at. You can't just vaguely just attach a term and call it healthcare, health insurance, as if they're the equivalent thing. They're not. And nevertheless, there's you, the observer of Twitter, the reader of Twitter. Out it comes, and you can see by the tweet there were 19 likes and the discussion that I did not, I'm not going to try to pursue. And I could have tweeted back, right? Or I could have joined the conversation by, Dear Miss Krenrich, you realize that you are not a health insurance expert, because health insurance expertise requires derivative knowledge. You are a health care policy expert, not the same. As usual, sand the floor. Before you know it, we will say goodbye to 2020. Good riddance. And January 1st, 2021 will mark the beginning of a important period for certain Medicare beneficiaries. Let's start with the first group. The first group of you are those who have missed enrollment deadlines for Part A and or Part B. Okay, this is the time that you can correct those. It begins on January 1st. It runs through March 31st. Your coverage will begin on July 1st. You have to wait until July. There's nothing that I can do about this. Okay. In addition to that, the late enrollment penalties will continue to accrue for you from January 1st through the end of June up until July 1st. Now, in addition to that, you are going to also be able to select a Medicare Advantage plan or a Part D plan that begins on April 1st. April 1st, that window will open. So first you enroll and correct your Medicare enrollment issues, and then you can select a Medicare Advantage or Part D plan. There is an exception about the late enrollment penalties I just mentioned, meaning that are there people who can get away from the late enrollment penalties? The answer is yes. And the answer is yes if you qualify for extra help, which is the federal program to assist with prescription drug costs. Applying for extra help goes through the Social Security Administration. You can find a link on the website for the book, www.maximizeyourmedicare.com. It's there in the lower right-hand corner. There's a column of official links. You can go there. The issue is that you have certain income limits as well as asset limits. So just simply being late doesn't qualify you for extra help. That said, that period begins on January 1st and runs through March 31st. The second set of options that you have that begin on January 1st are called the Medicare Advantage Open Enrollment Period. Now, no one asked me, right? Don't blame me. No one asked me to name these, enrollment periods. This is not really the name that I would have used. It's not. Again, no one asked me. And I candidly don't really even have a better alternative. So what I'm going to do is I'm just going to dive right in and tell you how it works. The most important thing you need to know here is this period, the open enrollment period, the Medicare Advantage open enrollment period, only applies to you if you are a current Medicare Advantage policy owner, meaning that you must be a policy owner on January 1st of 2021. Then and only then do these stipulations, the things that I'm about to share with you on this point, do they apply to you. They do not apply to you if you are on Medigap. They do not apply to you if you only have original Medicare without Medicare Advantage. They only apply to you if you are currently enrolled in Medicare Advantage. I'm speaking slowly so that I am not misunderstood. Okay, so here we go. Now, if you are enrolled in a Medicare Advantage plan, you have the option to switch once. Right here, January 1st through March 31st, if you live in a particular location and you've not moved or any other situation, then you can move from your existing Medicare Advantage plan to another one that is available for enrollment in your zip code. That exists. Now, you could say to me, Jay, why would I ever do that, et cetera, et cetera, et cetera. Well, the reality is there are lots of reasons. Number one, you find out the network is not exactly what you thought. Number two, you thought that your prescriptions were going to be treated the same, but they could have been treated differently by another. Number three, you found some added benefit package that exists in another Medicare Advantage plan that doesn't exist in your Medicare Advantage plan. Number 4, you decided that you want to get some extra benefits for such as the rebate on Social Security payments for Part B. I rolled off 4, no script still. There are going to be others. So there are those possibilities that you can change once and only once during this period. Okay? Now, there's important stuff to note here about marketing, the rules on me. And they are the following. I can't call you. That's very important, right? I'm not going to call you to say, hey, Mr. X, do you realize you could change your stuff? And I know you're over here. Are you sure you don't want to change to over there? Can't do that, okay? The rules are very clear and they're quite restrictive, okay? I have persons that I know that I've reached out to during the annual election period, which just ended on December 7th. They didn't make a change when I suspected that might have been appropriate. Okay, so that was entirely possible. So, but the point is that people like me, people who have licenses, people who are appointed with the carriers, cannot proactively reach out to you. You've got to call me, you've got to send me an email in order for that to occur. So that's it as far as this portion of the open enrollment period. There's a whole second set of other things you can do if you are an existing Medicare Advantage policy owner and you want to make a change. You can cancel your Medicare Advantage plan and return to Medicare Part A, Part B. You can also select, as a result of that, you can also select a Medicare Part D standalone prescription plan. So you can go from Medicare Advantage to original Medicare A, B, and then enroll in Part D. Now, I'm not going to be here for this video, I'm not going to say whether or not this is a great idea. Okay. All I'm going to say is that Medicare Advantage plans must have an annual out-of-pocket maximum limit. Okay, so over here. Over here, Medicare, original Medicare A, B, and D by themselves do not have an annual out-of-pocket maximum. Okay? You can see that in big bold print in multiple locations on my favorite book on Medicare. MaximizeYourMedicare.com. Anyway, so those are what you can do. Now, part of that is I suspect that people are using this period, it's viable, to switch from Medicare Advantage to Medigap. That is possible during this period. A whole bunch of stipulations, a whole bunch of things need to occur. Okay. If you are not entitled to guaranteed issue, or which is the federal term, if you are not in the Medigap Open Enrollment Period, which means the 6 months that start on the day that your Part B coverage date begins. If you don't have another stipulation by the carrier, which allows you to get something called guaranteed acceptance, which is not federally protected. It can be granted by the carrier, for example, above and beyond the federal stipulations. So what you have is you've got a federal rules. The carriers follow them, period. End of story, full stop. I defy anybody to show me the situation that doesn't occur, that never occurs. The rules are federally mandated. The carriers follow them, period. That said, above and beyond, there can be stuff over here, which means that the carriers may have elected to relax the rules in the buyer's favor. It can't be worse than this. It can be better than the federal rules. Now, that the rules vary wildly, carrier to carrier, state to state. Okay. The fourth one is that you could live in a special state with special expanded rights, which is kind of like this guaranteed acceptance, right? For example, the state of New York, you have year-round Medigap open enrollment. Okay. California, birthday rule. Okay. Missouri, anniversary rule. And different variations, in other words, that allow you to go from Medicare Advantage to Medigap outside of this first quarter. That does exist. However, for the whole rest of everyone, it's very important to handle this carefully. It's very important to handle this carefully for people if you want to switch from Medicare Advantage to Medigap. And the reason for that is that, let's just say you want to switch to Medigap. And you call up your Medicare Advantage carrier and say, okay, I want to cancel. The Medicare Advantage carrier will allow this. Canceled. You then go over here and then you apply for Medigap. And let's just say that you don't have any of those 4 examples that I just gave to you a few moments ago. If none of those 4 apply to you, what happens if you get rejected over here? What's going to end up happening is you are then exposed to Part A, Part B, and Part D alone, which means you have unlimited financial exposure if you got seriously ill, had to go to the hospital. Remember, you've Part A deductibles per benefit period. Under Part B, 20% not covered by Medicare. Since there's no limit, and you've canceled your Medicare Advantage plan, that leaves you with Part A, Part B alone without Medigap. So the bottom line here is make sure to get and to secure your Medigap acceptance first, and then double back to Medicare Advantage. Now, this is subtle, agreed. This is administratively complicated because in order to get accepted by Medigap and in order to cancel your Medicare Advantage, you have to provide documentation and evidence to each other. And it is not any fun for everyday people to communicate in a cohesive, coordinated way with the carriers so that the carriers involved don't mess it up, and so you aren't sitting in never land without exactly knowing your status. It's my job to make sure that everyone is on the same page. You know, most of the time I make a mistake of some sort. Somewhere, someplace, something goes wrong, right? Let me just turn this thing off. Hold on for a second. So somewhere something goes wrong and I've omitted something, some small detail that I wanted to include. This time it's actually big. There are 2 other things that you need to know during this Medicare Advantage open enrollment period. Number 1, these rules don't apply to you if you qualify for extra help, which is the federal program for prescription drug benefits assistance. Okay? So in other words, if you do qualify for extra help, you always have the once per quarter ability to switch among Medicare Advantage plans, period. That's it. If you are part of Medicaid, that means by definition that you are entitled to extra help. So that applies to you as well. Okay, so that's the first one. The second one is that if you are switching into a 5-star plan, 5-star as determined by the CMS, Centers for Medicare and Medicaid Services, if you're switching into a 5-star plan, you do have the right to switch once during the year, irrespective of the date, as long as it's in the first 3 quarters. Whew. All right, everybody, that's today's edition of the Maximize Your Medicare Weekly. Be sure to hit the subscribe, the like, and the notification button. It'll tell you when new videos arrive. It also helps other people discover the channel. Oh, last thing. You can go to TikTok, where I've posted my very first video. Happy holidays, everybody.